Thank you for being here. This is the
Hello, everyone. Thanks for joining us on the media briefing for this Wednesday. We're going to start off with our questions for Dr. Moreno about COVID-19. So if anyone has questions for Dr. Moreno, go ahead and put them in chat. Dr. Moreno, would you like to take questions, or do you have an update for us? How would you like to begin?
Oh, hi, Maya. Yeah, here to take COVID-19 questions for public health.
Terrific. Okay, I've got one question for you so far. Dr. Moreno, what can you tell us about the Omicron BA.2 subvariant that the CDC estimates to make up nearly a quarter of new COVID cases in the United States?
Sure, I'll do my best. So we've been we've been testing for the various COVID variants now in our public health laboratory for some time. And in the month of, I believe, January, 95% of the, variants detected were Omicron. And in February, 100% of the variants that were tested among Monterey County residents were Omicron. And in March, we still are seeing just Omicron, but now we're starting to see, I think we've seen two BA.2 variants. So this is the new variant that's become the dominant strain in a few countries, notably, I think, Denmark and the United Kingdom. And so what the little bit of information that's available suggests that it's more infectious than the dominant strain here in California right now, but it may not be much more virulent, meaning it may not cause more severe illness, hospitalizations, and deaths. And if that's the case, then that's good for us here in Monterey County. So we will continue to collect specimens, receive specimens from our various partners, and we'll continue to run those for typing the variants here in Monterey County.
Thank you. Another question for you, Dr. Moreno. How likely is it that everyone will need a fourth vaccination dose outside of just immunocompromised persons?
That we'll have to wait and see what the research shows and what is presented to the Food and Drug Administration, and we'll have to wait and see what Centers for Disease Control and Prevention's advisory committee recommends to the CDC. So again, we'll have to wait and see what the research shows and see what guidance comes out of our FDA and the CDC.
Thank you, Dr. Moreno. Any other questions for Dr. Moreno today before we let him go? One more, Dr. Moreno. If the Omicron BA.2 variant is more transmissible, what advice would you have for all of us?
Oh, yeah. So still the main thing is to get vaccinated if people haven't been vaccinated, because still it's the most effective way of preventing COVID-19, both illness, hospitalizations, and deaths. And for anyone who is concerned about getting seriously ill with COVID, so if people are immune compromised, for example, even if they've gotten boosted, vaccinated and boosted as recommended, they can still wear face coverings where it's not required. So they could wear face coverings in public indoor settings, even though that's not required anymore, as a means of mostly protecting themselves from an inadvertent exposure from someone who's contagious but may not have symptoms. So that's another layer in addition to vaccination that people can take to protect themselves if they are concerned that they may be at greater risk than the average person in the population from getting sick or seriously ill from COVID-19.
Thank you, Dr. Moreno. Any other questions for Dr. Moreno? Okay, I've got another one here for you. The White House has stated funding for COVID is going to dwindle down starting next week. Is that a concern for us locally?
I can only speak for public health. We do rely on some federal funding that comes through the California Department of Public Health to support our enhanced public health infrastructure and to provide additional resources. So we are in communication with the California Department of Public Health on funding sources And we will do our best to continue to deliver the level of service from public health that we can with the funding that we have, as long as we have the funding. And we will look for long-term solutions to maintain the infrastructure that we've developed during this pandemic, in hopes that we can continue to provide a higher level of public health services than we've been able to provide prior to pandemic.
Thank you, Dr. Moreno. Any other questions for Dr. Moreno? Just giving it a couple more seconds. Seeing none, if we get any additional questions for you, Dr. Moreno, we will forward them. Thanks very much for taking the time today to answer some questions.
You're welcome.
So for the rest of our hour on our briefing, we're going to take the time to look back at Monterey County's second year of the pandemic. And there is a lot to look back on. We're going to start with vaccine. As vaccine became more available, a tremendous effort was made to vaccinate essential workers, particularly agricultural workers. And we are very pleased to have Chris Valadez, president of Growers Shippers Association, here to talk about the really the success story of vaccinating our local farm workers. Good afternoon, Chris.
Hi, Maya. Good afternoon. Thanks for the opportunity to talk to the group today. Looking back and focusing squarely on vaccination, I think the Monterey County story, at least over the last year, is really, perhaps surprisingly, a national story, or at least a story of national significance. It became as such for a variety of reasons, many partnerships, but we're proud, at least as a trade association in this region, whose membership base are the agriculture employers, from processors to shippers to the farm labor contractors themselves and the growers, to have been able to create and utilize an infrastructure, a registration system, and do at least the best that we could at the time to remove as many barriers and utilize the advantage of working through the employer with a through employer model to vaccinate as many farm workers, ag workers as possible, as quickly as possible. Those were really our dual goals: vaccinating as many as possible, as quickly as possible. And what really enabled us to get there was a couple things. First and foremost, trust. If employees were completely unwilling, or the majority of them were resistant to taking us up on our offer to create a vaccination system, which was really theirs, it was really their own vaccination system, we wouldn't have been successful. We wouldn't have really gotten out of the starting blocks. But because we were able to work through the employer to build up trust amongst the employee base, company by company, in addition to work through the obstacles at the time around vaccination supply. If you go back to late December, January, and February, where vaccinations were in limited supply, particularly as they related from vaccines available from the state of California to the respective counties, we were able to work through, around, and break through what was then a limitation for us and the ag worker and ag workforce population, with what was initially a pilot program that Grower Shipper, along with Clinica de Salud, were able to access through U.S. Health and Human Services. And so through that program and the ability to gain access to what became comparatively a plentiful supply of vaccine, and the model that we had stood up, learning from the year prior, our housing model, where we created our COVID-19 housing program for farm workers, that then became the model for the state of California's subsequent housing for the harvest. We thought we had a good shot at being able to capture the interest, the attention, and physically serve through a mass vax model created both here in Salinas at the Rodeo grounds and in King City. If we can bookend the valley and be consistent and do it every week, every weekend, could we hit 2,000, 5,000, 6,000 per event, and hopefully make successful progress in a way that stands to significantly impact and improve, human health, or at least the response that people would have if ever infected by this virus in the various forms. And we were able to do that to a large degree, so much so where, going back to where I started, that this became a national story. It became a national focal point as to, well, how did for a large population base, since you're looking at about 60,000 agricultural workers at peak in the Salinas Valley, a large agricultural sector, what were they able to do that others, whether throughout the state of California or other large like agricultural regions with a high population base, what were they able to do differently? I think, efforts were similar in terms of intent in trying to serve the community. I think where we were fortunate is the fact that we built the infrastructure when we built it, that we had the vaccine supply from where we had it. And I think the skill and the intensity of the effort wasn't just a registration link, here you go, English or Spanish, maybe it's not even your language, have at it and leave somebody alone. It was a very hands-on system, which then enabled us, by the time, thinking back to it, Secretary Becerra came out to visit and call attention to the success of the program. We're at a 75% full vax rate amongst the agricultural workforce population late July. Of course, vaccination, take rates were different moving beyond July into the fall and into the winter, but even carrying forward, we were still running our program, doing some more mini mass vax service and also at-site employer type services. We got up to 90% by the winter of last year. And so moving forward today, we're at about 95% full vax rate amongst that population, which has been significant. Of that, our program is approximately 2/3, 66% of all of that vaccination service. But again, there's a lot of work involved. You had educational outreach supported by the County of Monterey, the Community Foundation, the VITA program, all of the hospitals, all of the clinics, all of the pharmacies. And so I think coming together as a community, we were able to go from an ordinary example to an extraordinary example that became a national story focused on Monterey County because intensity, effort, skill, and determination that we were just not going to leave this population behind. And so we're proud to do it. As Dr. Moreno said, we're not completely out of the woods yet. And so I think it still remains our primary focus, at least here at Grower Shipper, to anything and everything we can to help people with more vaccination, more boosting, more everything to the extent people are interested so that we can help protect them against severe illness, hospitalization, or even worse. And so it's a story that much of it has been written, but much of it remains unknown, and we're proud to have been part of it in a significant way thus far. So thank you, Maya.
Thank you. Does anyone have any questions for Chris Valadez? I know I have a question. I think people wonder, did you do it just because you wanted, workers to be able to go to work, which is, you want to keep your businesses going, but you're also feeding people. Agriculture is a business, but it also is a business of life. Do you feel like you really helped contributed to the health of the nation by not only keeping your workers safe, but by being able to deliver food when people were, in the middle of a pandemic and assuring people there'd be food for them?
So business continuity, not all businesses were treated the same, and that's a story with perhaps different conclusions and opinions, but agriculture was one businesses in the nation that was deemed essential, right? And its workforce was essential. And so there was an expectation that sector must continue. And we're not making, no disrespect to anyone who makes lollipops, they're making not only produce, but they're making the healthiest form of produce you can produce for a consuming public, from broccoli to cauliflower, your vegetables, as well as your high vitamin content, berries that are produced from this region. And so I know we were able to significantly reduce the risk for many of these farming operations where without the ability, not just from vaccination, I think even quarantine and isolation was significant. Without the outlets that they had direct access to, with as few barriers as possible, there really weren't any for the employer and their employee through the programs, registration included. It really wasn't there. We were able to make it as easy as possible to enroll and just take access to a service. It really reduced the risk of these operations not being able to kind of make their production runs, which then would have an effect on whether you harvest that lettuce or that broccoli or those Brussels sprouts or those strawberries. And so that was a significant benefit. That is also the Monterey County story and how Monterey County touched the nation through this moment in time. And what was also significant is the onset of, I can't say the virus, but at least the public health responses and the political responses from a shelter in place type of perspective. That coincided with the production season here in the Salinas Valley, which was that spring. And so, those challenges from 2 years ago advancing forward, it was significant for these businesses, but I think they also had advantages, and the advantages that they had were they had tools, they had an infrastructure, and they had resources in place to help mitigate and manage their way through these challenges. And as a result, it made a huge impact on the food continuity, food stability, and it wasn't possible without the ag employee reporting to work and the employer being able to operate their business, 6 days a week in general in agriculture. And that was huge for us.
Thank you very much for sharing the success story. It's nice to be reminded of the successes that we have had, despite everything that has happened. Thanks very much for joining us today and sharing that part of this review. We're going to look at Monterey County's second largest economic driver, tourism. Tourism really suffered during the pandemic, and as the state reopened, there was hope for recovery. And joining us is Janine Chikarat with the Monterey County Hospitality Association. Janine, thanks for joining us again. We've had you on the briefing over the last couple of years. Tell us how things are going with hospitality now.
Well, thank you, first of all, for having me here today. And, recovery is moving along. It's happening differently depending on the type of business that you're operating. But for the most part, you'll see, if you look at the local city and county revenues, they look extremely strong. And I think in a lot of cases, people didn't realize it was going to come back as strong as it has so quickly. That's the good news. The bad news is that it isn't coming back through occupancy and the number of visitors that we're having. It's coming via rate. And so that rate is driving the revenues, which is fantastic. But we're still missing a large segment, which is our group travel business. And we're just now starting to see it come back to life. You can see the leads coming in and people are booking long-term, which is fantastic. But we still need to get corporate America back in their offices and back traveling and giving back into the rest of the economy. And that has been that's been probably the biggest challenge in terms of the overall health and recovery of our industry. But we've been fortunate. We've been making it up on the leisure side of travel, and the hotels last year, as I said a minute ago, the revenues to the cities and the counties has been very, very strong, and it's called revenge travel. We're going to continue to see it. People will pay whatever just to get out, and it is amazing to see this. It's a phenomenon that we've never ever seen in our industry. And it's great to see, but it also, how sustainable is that long term is another question that begs to be answered. The Commissioner of Visitors Bureau from the very beginning did a fantastic job creating a recovery task force and setting together short-term and long-term plans in order to bring people back into our community to travel. At first, we had to tell people not to come visit, which was so anti what we normally do in our industry. But now they, along with the state of California, are doing a fantastic job promoting California. The state of California is doing what they did when 9/11 happened, and they're promoting travel within the state in order to take care of all the businesses within the state of California, and that's fantastic. They're also investing for the very first time into group travel market. They've never in the history of Visit California invested in group travel, so that's helping. That's helping as well. That the short-term business where people were just booking very last minute is starting to stretch back out again, which is also good. We're starting to see people plan more in advance. We're starting to see international booking, and you'll start to see the return. You'll definitely see international visitors here this summer. And it's just amazing to sit and watch how the dynamics can shift from, one moment you're shut down and the next moment you're back in business, and just how how it really has impacted the industry both positively and negatively, I'd like to say. But we have our challenges, and we have challenges that are similar to other industries in our community. I'd say that the big three are number one, staffing in general. We struggle to hire on all levels. That's why you'll see maybe your favorite restaurant isn't open 7 days a week. They're only open 5 days a week. And it's not just a cook or a dishwasher or a housekeeper. It's on all levels. So there's corporate positions that we're struggling to fill as well, and that's frustrating. The second one, which as a community we really need to advocate on is childcare. And it's both the cost of childcare and the availability of childcare. And I'll give a great example. I have an employee who just had her second baby, and it's $1,200 per child to go to childcare for her and her family. The good news is they have availability for her to have her second child be taken care of, but they don't have the staffing in order to be able to accommodate that child. So here you've got a cost issue of having to spend, $2,400 a month for 2 children and then not have the availability to take care of it. So where does that leave that individual? The other, cost or the childcare issue is the state per diem doesn't factor in cost of living. So we have a very high cost of living here. So there are people that I know in our community probably want to work more, but they can't risk the fact of losing what the state gives them in order to further childcare. So we've got some huge challenges there, and it definitely affects not our industry, but all industries. And then lastly, immigration. And I will stop at that because we could have a debate on immigration all day long. But it would be wonderful as a community if we can come together and fight for our DACA children and help them be able to fill out their paperwork and help people understand that, yes, they can go to work, and we need to put them back to work. So at that point, I'll stop there.
That's great. No, thanks for that really thorough interview. And also it's great to go see down the line the impacts that affect our overall economy. It's not just you can't get a worker, it's that worker can't get what they need to come to work. So you're really showing the deeper picture. Are there any questions for Janine on hospitality or those related issues? Not seeing any coming in. If we do get some additional questions, we'll forward them to you. Thanks very much for sharing this overview. I really appreciate it.
Yeah, well, on behalf of our industry, I just want to thank the community for the collaboration. It was definitely been a year where leaders have come together the last couple of years to make it happen, and we have a lot to be proud of. And there's some bright spots that came out of COVID as a result.
It's nice to have those bright spots.
Thank you.
So as Janine was talking about, employment has been a real challenge, and Monterey County's employment situation is improving the second year of the pandemic. And here with a labor snapshot is Javier Vanga. He's with our workforce development department or bureau with the county, and he's going to give us an overview of 2021 in jobs. Hi, Javier.
Hello, 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 and thank you for having me. I'd like to start. My intro was going to be a little different, but I heard when Janine started talking, I just got very interested in what she was saying. And I just wanted to report right away that our leisure and hospitality industry, we got the January report for unemployment and also for the number of employees that are working. In accommodations and food services, we're up 52% over last year, and that's in employment, which is a great number. And food services and drinking was up 47%. So we've had some really good increases over last year in leisure and hospitality, and I think that's just one of the factors was opening up all the doors again, and that's really helped us an awful lot in getting some of our people back to work. But one of the questions that I want to answer if I can, but it really is a question that I don't think we can answer, is where did all the workers go? We paid a lot of attention in the last few months in the last year or so on the Great Resignation, which seems to have been a time when workers began looking for a lot of things, among them better wages, better work culture, and benefits, more benefits. And through all that, I think it was a million hospitality workers quit in November of 2021. And that's quite significant, not in Monterey County, it's the nation, by the way. So these quits also occurred mainly in low-paying jobs where the stimulus check was very possible for them not to work. But since the stimulus checks have ended, we're seeing some of the workers that left are returning to work. But they're returning to work not necessarily in the jobs that they had before. So there's been a shift also of some of those low-wage workers looking for more opportunities, more wages, and actually looking for, growth in another sector. Monterey County Board faces a particularly challenging workforce environment right now. We also have a low labor participation rate that is having a considerable impact on a couple of our industries: hospitality, construction, and healthcare. How those three are really, besides ag, are really the breadwinners for us, for our economy here in Monterey County. So to face those challenges, we're working with one of our workforce development consultants to research and produce a report that will explore, quantify the different reasons adult residents are leaving and remaining out of the workforce. That's one of the areas that we're struggling to get more data on and really struggling to understand more. So, and on top of that, the study will also examine how different motivations are impacting current attitudes around willingness to work, how that behavior is expected to change, hopefully in the future, and what it means for the businesses in our community and for us in particular. Because the report will also explore how the Workforce Board could potentially respond and provide new or changing services and resources for our job seekers and local businesses. We've had to make this past year, we've been sitting down and talking internally, what can we do to better help our clients and to better understand the clients. As you all know, the labor force participation rate is actually the people that are working or actively looking for work. And so the ones that are not actively looking for work is really one of our targets also, what's going on. And also, we're also interested in what we're calling the encore worker, the over 50, 55 worker who left the workforce in the last year, but are also looking maybe to change their career or to look at volunteerisms or whatever it may be. We're looking at that also. And so this report, they're going to start work probably this in late March, early April. So hopefully by June, we'll have the report out, and hopefully I'll come back during that period of time and give you some of the key takeaways from that. If I can share my screen, let me get it ready first. There we go. Okay. All right, Maya, you ready for me to share?
Yes, go ahead.
Okay, everybody can see the screen?
No, not yet.
Not yet? Okay, let me go down back one more and play and go back to my Zoom and say share, right? Sorry.
That's all right.
There we go.
Got it.
Great. So we produce this every month, our labor market snapshot. We put it on our website. We distribute it to our clients, our staff, and our partners. You can find this at montereycountywdb.org, labor, and on the labor market tab. So we do this every month. We take the EDD numbers that come in on every month, and we develop the snapshot. It's a really good tool for not just our clients, but also for our partners also. As you may know or not know, if you follow labor market, February is basically the month, and January and February are the months that EDD does its benchmarking. So we don't get a report for February or March. January or February until late in the year. So March 11th, 2022, we finally got it, and I'll update that for you in a little bit. But the next report will be for February. It's not released until March 25th. The report that I'm going to talk about today, and again, I'll just go pretty quickly with this, so you can also download this and look at it during on our website. So this is a summary that EDD did for all the counties talking about 2021. and what really has happened in certain areas and certain categories. As you can see by the first slide that I have up, in December, they ranked all the employment sizes. Of course, farm is our number one. Second is employment size is government, and then so forth on the scale there. The unemployment rate for this month was for the December was 7.2. January, since we just got the January numbers, and it went up to 9%, which is really not that significant in the sense because we know we have this period of time that we work in here with agriculture that we do have, the seasonal changes. So that's kind of not consistent, but it's in that 8 to 10% range, historically for our unemployment rate. And then on the bottom, they talk a little bit about where the jobs really are and who is employing. They also put in what cities those ads were running from. Retail search person for the month of December was the number one job ads that we had out there, followed by registered nurses, which is becoming very, very difficult to hire for right now with a lack of workers that are out there in that industry. They've also looked at the change in employment from February to December. Overall, it wasn't that significant in the sense since 2019, the employment has only changed by about 2,000 plus. So we still have some ways to go, but at least, it is going in the right direction by increasing the employment that we have out there. They also did a report on what industries have recovered between April and December 21. As you can see, we have 6 industries that they feel are 100% recovered. But then we also have, 4 or 5 that have not. And leisure and hospitality is one of those. They were at 81%. And this is in December. We picked up some slack in January. And hopefully with February and March numbers, we might see that at 100%, we hope. But again, with people leaving their jobs and not leaving hospitality, not coming back to hospitality and going in another sector is still out there. That's one of the reasons also why the reports is going to be so important for us. This graph is really about the job postings. So we look at this on a monthly basis to see how many ads are really being generated. These are online ads. We have a couple of sources for this, and we try to really understand. Our job developers that work for us need to know what are the opportunities that are out there today, and so tracking this and then tracking the Indeed job boards and things like that, we can put a handle on the type of jobs that are really out there, but also the type of skills also that people need to help us understand, who's out there. So the rate for Monterey in January, as I said earlier, was 9%. As you look at the chart in the graph, you can see this is from 2020 September. You can see the dramatic decline over the last year. So 2021 really started off for us very high, and then after I think that's somewhere around I want to say June or July, we started coming back down again, and we got as low as 5% with the unemployment rate, which was really good. As you can see by the chart too, I pulled to 730, 7.30 because that went. They revised these numbers every during the benchmark period. So it's 7.3% instead of 7.2%, and then 9%. That might get revised up or down with the next benchmarking that they do. We also track the unemployment claims. You could see in April 2020 the number of claims that we had. That was the highest number of claims we've ever had in Monterey County history. And as you can see, over the year, it stayed pretty high, usually around over 10,000. But as we tackled 2021, it started to flatten out, and you're seeing almost after February, you're seeing an almost normal progression on unemployment rates. Normal meaning, that these are the types of unemployment numbers the UI numbers that we do get. And I always add something on these to figure out, okay, what's going on, what's out there, what is the industry saying, what is like in this instance, NPR, Planet Money, what are they saying? And they track a lot of labor market information, and I have various sources. And it's really nice to understand that, we're not alone in some of the, and what's happening in Monterey County, and because of the pandemic, and then the inflation period that we're going through now, the war in Ukraine, there's a lot of distress in this country right now. And so we need to know what's going on, what's happening outside our world, but yet then bring it and take these things and put it into perspective for what we have going on in Monterey County. Like I said earlier, in November alone, 1 million leisure and hospitality workers quit their jobs. So, we understand all this, but the biggest issue is getting the data that we tend to, not get because it's not available. We don't know. We know how many are unemployed, but we don't know how many are not looking for work. We don't know how many are underemployed. And that's something that hopefully this report that we have coming out will help us understand a little bit better. That's the snapshot that we produce, and we're really. Let me go back up here again. Okay, so that's a little bit about what we're doing in our in Monterey County, in the Monterey County. I can't talk today. I'm sorry. I've come off basically I'm rehabbing from COVID that I had in January, and the speech is getting better, but it's not there yet. But I want to thank you for letting me speak today. I will come back when we get that report, and then I'll share that with you. And again, I recommend you take a look at our labor market information page on our website. I think it has valuable information of occupations and the industry sectors, and we try to update that every 3 months or so, to keep it as fresh as we can.
Thank you. And first of all, glad you're recovering. Sorry you're not feeling better 100%. Thanks very much for sharing. I think if you could stop sharing your screen.
Yep, I'm going to go down there right now.
Great, great. Are there any questions for Javier while we have him and while he's feeling peppy enough to answer questions?
Thank you.
And we are still seeing your screen.
Really, I'm sorry.
Let's see if I can't.
I do not know why my Zoom does not want to stop sharing. There you go.
There we go. Thank you very much for doing that. Any questions for Javier on this employment information? Javier, can we make this slideshow available to our media partners?
Sure, it's on the website already.
Okay.
So it's on, Monterey County WDB.org.
Terrific. Thank you. And thanks very much for taking the time to walk us through this information.
Well, thank you so much. Next time I'll be able to talk a little bit better.
We forgive you. Go rest.
I will. Thank you.
Well, and so moving on to something that affects virtually everyone, because I'm not sure how many people don't have a child, but almost everybody has some relative in school these days. In the last year, schools have had the tremendous job of keeping education coming to students, as well as managing being closed and then managing being open safely again. We're very pleased to have Dr. Janine Gus, Monterey County Superintendent of Schools, here to share with us a look at what schools have been through in the last year.
Well, thank you so much, Mia. It's a great honor to be here today, as always. And I'm going to real quickly try to share my screen. Here we go. Let's see. Okay, can everyone see my screen okay?
We sure can.
Awesome. And I'll go as quickly as I can. But again, thank you for the opportunity to be here today. It has been quite a crazy last 2 years. So I'm happy to share with you today what we have been struggling with. And hopefully I'm going to end on a good note, because as you know, schools always step up and we always make sure we're doing everything we can to make every opportunity possible to our students, and we keep things as positive as we can. So let me jump right in. Okay, hold on one moment here. I'm going to try to figure out how to advance the slides. There we go. Just real quickly, I always like to share with everyone, what in the world does the Monterey County Office of Education do? Well, we provide the leadership, support, and service to our 24 school districts and our 8 charter schools here in Monterey County. And we also provide support during pandemic and other emergencies to all of our private schools in Monterey County as well. And I have to say, it has been quite the pleasure serving in this position to both our public and our private schools. It's been a great relationship building. Who do we serve? Well, we serve, not going to go through all the demographics here, but as you can see, we serve 75,660 students. And this chart gives you a little bit of information about that makeup. So it's always interesting when I get to share that 76.9% of our students here in Monterey County are socioeconomically disadvantaged. A lot of people don't realize that. They hear Monterey County and they think that many of our students come from very affluent families. And some of our students do, but not all. So hopefully that just kind of gives you a quick picture of the students we serve. Now I'm going to blow through a few of these pretty quickly so we can stay on track. But I just have to share that one of our greatest challenges has really been the mental health crisis that our students are now experiencing due to the pandemic. Recently, a survey was taken by APA, the American Psychological Association, where 70% of parents articulated that their students or their children have really been negatively affected by the pandemic. What does this look like? Well, for some students, they're experiencing anxiety, other students, depression, some students, suicidal ideation. We are just really in this place right now where we are struggling with this mental health crisis, and we need to make sure that it's on our radar and that we're doing everything we can to support the needs of our students, our families, and our staff members, because it's truly been hard on everyone. You've heard a few of the presenters earlier today talk about the shortages in personnel. Well, I can tell you, even before the pandemic, we had a teacher shortage. The pandemic only exacerbated the problem to the point where now we have so many substitute teachers serving in our classrooms, and we're even needing subs for the subs. And I know in Javier's presentation, it said that education has recovered at 100%. I can tell you, I don't know where that data comes from, because we have not yet recovered. We are experiencing huge employee shortages, both teacher shortages and staff shortages. We need bus drivers, nutrition workers. We need all school personnel. And so on this slide, you can see here, our QR code is posted. If you are interested, or anyone you know is interested in working in the school system, please just scan our QR code and it will take you directly to EdJoin, which is the place where you can find all of the openings in education here in Monterey County, and you can fill out your application and come join our team. We need you. We need help. We're always recruiting. The pandemic also really, again, we all knew that we had a digital divide, but the pandemic really exacerbated that problem as well. When we had to shift from in-person learning to online learning overnight, it was quite the challenge. I'm sure many of you are familiar with this picture here of these 2 young girls sitting in front of the Taco Bell, trying to access the internet to do their homework. This really, I think, shared how deep this divide was, or I should say is, and it really brought attention to the issue. And I'm going to get to the good news in a minute. But before I do, I also just want to make sure that it's on your radar that these 2 young ladies, they're mom also worked there at Taco Bell. And so it wasn't just a perfect picture to show the need for the broadband issues to be resolved, but it also comes back to the childcare challenges that we were talking about a little bit earlier in the presentation. When schools are closed and childcare centers are closed or too costly, parents, what do? Sometimes they have to bring their kids to work. And in this situation, the kids couldn't even come in the building because all the businesses were closed. So we definitely need to address not only the broadband issues, but also the childcare issues. Just a little bit of good news around closing the digital divide. I'm happy to say that our MCOE Digital Equity Task Force did raise $2.7 million to help students gain access to both computer devices, internet connectivity devices. And I'm just so thankful that that individuals here in Monterey County are so very generous. We received, again, so many donations from various entities, foundations, individuals, just tons of people here in the county stepped up to help. And I'm just so appreciative for their generosity and the recognition that this is a real need. I'm also just excited to say that the work still continues on. So we have various other groups that are working in this space, also trying to help close the digital divide. We have Pruzio, who's doing some work in San Gerardo and a few other places in our county. We have a regional broadband task force that has started working primarily there in the South County corridor. And Monterey County also is doing tons of work to solve the broadband issue. They recently put out an RFP. They've made some awards to some various vendors who are going to be working hard to solve the broadband issues, especially in the ruralmost parts of our county where the needs are greatest. So that's exciting news. It's always wonderful to see people collaborate, come together, and try to help resolve these issues and address our problems. Okay, this is the big one, the state mask mandate changes and challenges. So many of you know that on March 1st, the indoor mask mandate at the state level shifted from being required to strongly recommended. Well, for schools, end of day, March 11th, the mask mandate also was lifted for, the state lifted the mask mandate for schools. Now, what that meant was that then you look to your local health jurisdiction to see if they are going to impose stricter restrictions or if they're going to align with CDPH. And in our case, that's what happened. Then what happens is each and every school leader and their school boards review their local data for their community. And I'm very, very thankful to the Monterey County Health Department. They posted a fantastic website where each school leader and community members can go on. You can look at the spread of the virus in each community by zip code, and you can also look at the vaccination rates by each community or in each community by zip code. And so school leaders looked at that data, and that's how they determined whether or not they felt it was safe at this time to again move from universal masking being required to strongly recommended. In our county, we have 3 school districts that are still requiring universal masking because their data indicated that's what they needed to do. I didn't put a slide in that talks about vaccinations, but I do just want to point out the fact that we still need to keep working on getting our 5 to 11-year-old age group vaccinated. We're doing tons of work in this space. We have vaccination clinics that are being offered all over the county. We even have a few that are coming up this month right here at our County Office of Education. So please help us get the word out about those vaccination clinics. Okay, so the good news. Right? I can't leave you on all of our struggles. Let's talk about some great things that are happening in our schools. Well, first of all, in spite of the pandemic, we were still able to engage students in many countywide exciting events that are hands-on, in-person. Monterey County Farm Day is just one example. We hosted the event here in Salinas, in South County, and in Monterey. And I'm so very thankful to our ag education community for making this event happen every year for all of our third graders. And this year it even included fourth graders because they missed out on this event last year. So thank you so much to our ag educators for making this happen. We also just hosted our Monterey County Spelling Bee this last Saturday. Very well attended. The kids were super excited and just wanted to showcase the first place winner here, Isabel Fujita, who is an 8th grader at All Saints Episcopal Day School. So congratulations to Isabel. Oh, had to share with you the best kept secret in town, and that is the Bob Hoover Academy. So the Bob Hoover Academy is an alternative education program here of the Monterey County Office of Education that helps young people learn, or I should say, earn their credits toward their high school diploma, but it also partners with the nonprofit Bob Hoover Academy. You see Sean Tucker there in the picture with one of our graduates. And the Bob Hoover Academy pays for flight lessons for these students. So the idea is that when they leave our program, they have learned to solo fly and they can continue on to earning their pilot's license. So again, very thankful for that public-private partnership. And there's room in the program. The program is trying to grow from 20 students who are currently participating to 60 students because we are building out a whole new space right here at the Salinas Airport. So spread the word. I also wanted to share with you that Wellington Smith, which is our educational program in our juvenile hall, just had a groundbreaking about a month ago to build a school youth garden. The idea behind this garden is to help our young people have those hands-on opportunities in a positive space, to be able to be one with nature and really let them know that we believe in them, we're working toward changing behaviors, to really encourage them to, what's the best way to say this? Embark on a new venture, positive, supported, and that they really can change their life for the better. So the goal is that when they leave this facility, they will continue to pursue their education and continue to participate in positive opportunities. Coming up, we have the science fair happening. Actually, the projects have already been submitted and the students will be, let me see here, let me check my notes. The winners will be announced March 26th. So we're super excited about the spelling bee and looking forward to finding out who those winners will be. We also have sporting events happening in all of the schools across the county and tons of spirit days. You see the students in the picture in the right there. They're celebrating anti-bullying month and just bringing out their school spirit, which is always very exciting. We also are preparing for state testing. That will be occurring this spring. And so even though we're having tons of fun and trying to find our new normal, we are also very academically focused and preparing for those very important state tests. Believe it or not, we're also at this time of the year, even though we haven't gone to spring break, we're already thinking about summer programming, planning for that. We know that students are going to need lots of opportunities to continue to engage, to be in person, to have the academic support they need, especially for those who have fallen behind and they need to catch up, and just to stay active during the summer. Of course, the most important thing we're gearing up for are our student graduations. So we have 8th graders, obviously, that will be promoting this June, and we have seniors who will be graduating. And we are really hoping, if all goes well with this pandemic, that most of the graduations can be back to in-person graduations. So looking forward to that and getting really excited. And of course, if you ever need any information about what's happening in our schools, I have my contact information here for you, and I hope that you will reach out. Please know it's been a very tough last 2 years, but we are doing everything we can to make sure that we are providing the highest quality education to our students, that we're supporting our families, and that we can end this school year on a positive note. And with that, I'll open it up to any questions you may have.
Thank you very much, Dr. Gus. What a great walkthrough of both the challenges and the successes for schools. Any questions for Dr. Gus while we have her here? I'm not seeing any come in, but if any do come in, I will forward them to you. We want to turn to some of our other safety net support programs that we've had during the pandemic. Monterey County was able to partner with one of our top nonprofit agencies on many pandemic support programs and assistance programs. Katie Castagna from United Way is here to share information about that. Hi, Katie.
Good afternoon, Maya. Thanks for the opportunity to report back on a couple of programs we've had the pleasure of partnering with the county on. And really thinking about this week marking an anniversary of sort for a couple of those large programs. Thinking back a year ago, and actually earlier in the pandemic, when we were concerned about supporting people who were isolating, people who had COVID themselves or had family members with COVID, and households that really all we wanted them to do was stay home and don't spread COVID. Knowing that many of us have access to health insurance and sick pay, but many of our workforce doesn't for various reasons. And so the idea of providing income replacement for those people that may have been independent contractors, working in their own small family business, working in companies that for whatever reason didn't offer sick pay to them, the idea of a stipend program, and really a pilot was developed by the health department to provide a cash stipend for individuals in that circumstance in order to incentivize them to stay home and to make it possible for them to stay home, so that they knew that they would have some financial assistance if they were able to participate by being monitored, stay home, and at the end of that isolation period, they were then eligible for a stipend in the form of a gift card worth $1,000. So the health department came to United Way and asked us to help coordinate and distribute this benefit. And if I don't have a lot of slides, don't worry, I know we're running short on time, but I have one I wanted to share, if I may.
Please go ahead.
Okay, great.
We'll go a little over our hour.
Okay,
no problem.
You. This is a snapshot of our report for last month with that stipend program. And what I wanted to what I want to share with you is how this network of healthcare providers, the clinics through the county and through Clínica de Salud, these were participating clinics that enrolled their patients who were eligible for this program. And once those individuals completed the isolation successfully, then they were deemed eligible to receive the benefit. So you'll see this collection of clinic partners that worked very closely with the United Way staff, and specifically with our Calissa on our 211 team. So this is very much tied into our community support through 211. And at the end of that period, then those individuals received the $1,000 gift card. So to date, since December of 2020, when that program launched, we have distributed nearly 1,300 gift cards. And that is, times $1,000, a significant investment in our community. But what it meant is that these people had money to pay their rent, to buy groceries, or whatever it was that they weren't able to acquire while they were isolating. So it's really that income replacement that provided a lot of peace and peace of mind to those members of our community. And again, this was available community-wide, although targeted to the highest need zip codes. In addition to that stipend pilot program, next the county developed added a stipend to the Housing for Harvest program. And you might remember early on, there was such great support for our agricultural workers, and through the Department of Social Services, there was a wraparound program that provided alternative housing, meal delivery, lots of other services, again, to help people isolate safely, knowing that many of them did not have income replacement for that period. So we added a component of issuing the gift cards for those individuals, those agricultural workers who successfully completed the isolation. And this is twofold. It's one, to help those individual families and households, but it also helped us as a community stem the spread of COVID, which would have been even greater if people felt so desperate that they had to continue to come to work and be out in the community. So with Housing for Harvest, to date, we have distributed cards to 72 individuals. So that's a much smaller and higher touch program. But, you can see that it's had a huge impact as far as, hundreds and hundreds of people receiving this basic needs support. And that is cash that they could use however they needed it most. It wasn't really dictated what it would be used for. In addition to that, and I know I've spoken to many of you about the Emergency Rent and Utility Assistance Program, but this week marks a year since we launched that program in partnership with the county. And to date, the total contract is $50 million. And we have made a significant, taken a significant bite out of that in the form of distributing rent and utility assistance to thousands of households. Again, that program is designed for people who had a COVID impact, and it's a financial impact. So many people who had reduced hours, lost jobs, had unpaid sick time, whatever, if they got behind financially during COVID, they were eligible to apply for this program. So in 2021, we distributed $26 million of assistance, and that was paid directly to landlords or utility companies. In most cases, there are a few exceptions where the tenant is paid directly. And we've done this through a network of about 12 agencies, public and nonprofit agencies who work with United Way to distribute the assistance. Nearly 3,500 unique households were served in 2021. The program's continuing. Just last month, we served 895 households, and we are continuing to distribute assistance. We are prioritizing households that are at immediate risk of eviction. And as I said, we're spending at such a rapid rate that even though it was a very large program, we anticipate we will be depleting the funds in the coming months. So we're having to be very careful in prioritizing folks. The goal of this program is to keep people housed and to address the needs of our lowest income population. So 50% of the area median income or less. That was the other criteria in addition to the COVID impact. So it's exciting to know how many hundreds of households we're helping through this assistance every month. And it's been a wonderful opportunity for us to help people catch up from all of the interruptions that we've all felt during the pandemic. We know it's going to be an ongoing struggle, that housing costs were a challenge before the pandemic, and that has not gone away as an issue. But we are very pleased with the ability to have assembled a network of partners and provided this direct assistance. Again, not only for the households affected, but even for our landlords. Many of the landlords were at risk of not making their mortgage payments. And so this is really helping keep the infrastructure of our housing as intact as possible. We continue to apply for more funding from the federal government, again, in partnership with the county. And we're hoping that there may be future funding available, but we're at this point spending the current allocation quite quickly. And at some point, unfortunately, there will be other choices we have to make as far as how to meet those basic needs of our lowest income workers. Thank you very much. That's my report on those two programs. I could go on many others, but those are two very significant ones that the county has invested heavily in, and we appreciate the partnership.
And we appreciate the partnership as well. And thanks very much for showcasing what has occurred. I know people have heard about the program, but it's really great for people to know just how effective and how helpful and how widely the money was able to be distributed to those in need. I'm going to continue with our last little section. If there are any questions for Katie and our Help with United Way, go ahead and put them in chat and I will forward them to her when we're done. So I would be remiss if I didn't just add a little more information about some county programs that are, let me share this. There are a lot of county programs that were helping support the community during the pandemic, and I just want to make sure that we showcase just a few of them. For those who don't recall, we do have alternative housing programs. These are programs to reduce the spread of COVID-19. They were launched in April of 2020, and they continue today. From March 2021 to February of this year, our Operation Oasis program assisted 400 people, Project Room Key 13, and Housing for the Harvest 163. We've talked about VITA on the briefing many times. This is the Virus Integrated Distribution of Aid, this really terrific collaborative program to provide outreach, education, and wraparound services to vulnerable communities and residents. It was launched in January of 2021, and it has had a wonderful impact on people in our community. Touching a little bit on vaccine, you may remember about a year ago at this time that Monterey County had less vaccine available than our neighboring counties because we didn't have multi-county entities which also received vaccine separately at the time. And this really put us at a disadvantage. There were advocacy efforts for vaccine, and that resulted in a change of allocation to us. Also, we really want to take a minute to applaud the Monterey County Public Health Bureau, which managed mass vaccination clinics to get people vaccinated. And as vaccine became available, Public Health has administered more than 47,800 doses of vaccine since January of 2021. And then we've talked a little bit about misinformation in the past. And the county really has worked very hard to provide helpful and accurate COVID-19 information since the pandemic began. And that became even more important with the increase in misinformation that began to abound in the public sphere of things. This is just a snapshot of some of the work that we have done. We've had webinars. You may recall a webinar on student vaccine. We've really worked hard to provide responsible social media information about a wide variety of topics. We've had these regular news briefings to provide information. We've been really consistent on our outreach with accurate information. And of course, we've had our VITA and community healthcare workers working in the community, not only doing the work that they have done to get testing and vaccine and information, but getting the right information to people when they need it. And so with that, if you have any questions for me, send them along. We're going to wrap up our briefing today. We're a little bit over, but we hope the information was good. Thanks for joining us on the briefing this week. Our next briefing is next week, and we'll see you then.